Pain with push-ups, you're going to want to listen up because in this video, we're going to go over some of the common causes of pain during a standard body weight push-up, some potential alterations that you could make to continue doing push-ups in the meantime, and some of the common causes or underlying limiting factors that may be contributing to why pain comes back time and time again after or during push-ups. So in this video, we're going a little bit wider with our grip, and we're going to be showing a little bit more focus on stressing the pec muscles. So at the bottom of the motion, those pec muscles should be able to stretch out along with some of the muscles on the front of the shoulder to support some of the ligaments on the front side of the shoulder itself. If we don't have adequate support from both these bigger muscle groups as well as our rotator cuff, including our subscapularis muscle on the front of the shoulder, then the ligaments and some of the other passive structures on the front of the shoulder can end up taking on additional stress. When we do enough repetitions or we start to inflame or irritate this area, it can cause pain over the course of time. You may not always feel it during the session, but you may feel it later on in the day or the beginning of the next day. Or we can also get some issues with impingement or compression of tendons, muscles, other structures underneath the roof of the shoulder blade on the front of the shoulder. A few key things that you can do in the short term, especially if you're getting any pinching or compression, or more commonly referred to as impingement, is to create more stability through your upper back by pulling your shoulder blades down and back prior to going down into the pull-up. Or you can also ensure that you have sufficient stability through your core and lower back so that if you did have a weight resting on the small of your lower back, you'd be able to maintain sufficient control and stability through that area. If those issues don't correct what you're dealing with, or the pain doesn't come on until later, you may be dealing with issues related to inflammation. And then you're going to look at the overall volume or the amount of reps and sets that you're doing during a training session or over a given week or month, to where you're rotating in different types of push-ups or pressing motions, maybe doing close grip push-ups, maybe you're doing inclined variations, doing a combination of cable flies instead of push-ups, or bench pressing at various angles rather than just doing strict push-ups consistently in order to be able to help to rotate the stress or the load throughout your body.